Today is World Mental Health Day, and mental health is a huge issue for young adults. In fact, in a study of foster kids aged 16 to 17 years old, 1/4 have attempted suicide.
Joining us on the KOGO News Live Line, the Director of Programs at Promises2Kids, Rashida Elimu. Up to 80% of the statistics that we're looking at, up to 80% of foster youth suffer from mental health issues. Why would that be?
Good morning, everyone. And yes, obviously the trauma that foster youth experience very early in their lives really develops a lot of different things around their brain development and how they navigate around the world. So it's important just to give them an extra focus and extra attention as we navigate this mental health day.
What kinds of mental health issues do foster youth traditionally suffer from?
Foster youth usually have higher rates of anxiety, 5 times more likely than their peers, and 7 times more likely to have depression compared to those young people who are not involved in the child welfare system.
So what can people do to help alleviate this? That is a horrific percentage.
I agree. I think it's getting out, becoming aware, continuing to talk about mental health issues, destigmatize mental health for the larger community, especially for our foster youth, and then get involved in organizations that really want to support. There's always ways to get involved and really help and just lend to remind our foster youth that there are people out there that really want to care about them and help them restructure their lives to be competent and capable adults.
Now let's talk about other teenagers and their culture today. Surveys show that 90% of teenagers aged 13 to 17 have used social media. Now, social media, it can be great for some things, but it can be terrible for other things, right?
Right, 100%. So we're thinking about when I was younger, when we left school at 3 or 4 o'clock, school was over. But for young people today, you never leave school. Social media is 24 hours a day, 7 days a week, so you're always connected. And then so there's risk of cyberbullying, and that comes with higher risk for depression, higher risk for suicide. Young people are still developing that prefrontal cortex, so they may overshare with things that they may not want their peers to know, or their peers could bully them around. Additionally, they become a prey for predators who are on social media, and they're exposed to harmful content. So I think it's important really just to monitor and look at how we can support mechanisms to help separate our young people from social media, or at least push up the benefits of social media.
What kind of help is available right now for foster youth?
Well, getting involved with programs like Promises2Kids, our Guardian Scholars program that really looks at how to help our young people transition, how to cope with a lot of challenges. Promises2Kids partners with the Mental Health Initiative for young people as young as 6 months, when we're looking at our Kids Start program that really helps to look at how we can get babies reacclimated to, positive interactions with adults, positive interactions with the people that are around them, all the way to our Guardian Scholars program, where really just focuses on how they can develop their own coping mechanisms and how they can connect with the larger community and find support as they navigate their mental health.
Rashida Elimu joining us here on the KOGO News Live Line from Promises2Kids. Thank you so much.
Thank you for having me.